In this lecture, we are going to discuss four most important clinical scenario of the lipid profile. So let's get this started. First of all, that is first case is the 52-year-old male presenting with exertional chest pain after doing some work. And in the history of this patient is hypertensive, having high blood pressure problem, and family history of CAD, coronary artery disease. So this is the history provided by your patient. And after lipid profile report, what we see in it, total cholesterol is 280, while the normal value is less than 200. So it's mean it's high. LDL is 190, while the normal value should be less than 100. It also high. HDL 38, while the normal value should be greater than the 40, but in that case, this patient having 38, it's low. Not too much, but it's low. And the TG, triglyceride is 140, while the normal value should be less than 150. So it's also low. Not too much, but it's low. So the first thing that is high in our consideration is the total cholesterol, that is 80 uh, milligram per deciliter high total cholesterol. So chest pain, hypertension, and family history of the coronary artery disease. So what we will see in it, that is primary hypercholesterolemia, high level of cholesterol in the blood, that is the common thing. And why do we call it primary? Because it is cholesterol level is not due to another reason, like in hypothyroidism, in which you will also see the high level of cholesterol, but in that case there is no such scenario present in it. So that is why it is primary hypercholesterolemia. That is the one thing. And it goes towards the heart related things like chest pain, hypertension, and the family of history of the CAD. So we can say the patient having high risk of the heart attack or some diseases like the coronary artery disease. So what we will do in that case? So we will change the diet of the patient. Diet should be uh, properly, like we have to reduce the saturated fat in the diet of your patient, and we also recommend to lose the weight of the patient and increase the diet having more fibers and doing exercise. So that is the different management we can suggest in that scenario. And the drugs will be statin to reduce the cholesterol level. That will be the atorvastatin and rosuvastatin. So these are the drugs that reduce the cholesterol level inside the blood of your patient. So this is the first case, that is primary hypercholesterolemia. Second case is a 45-year-old diabetic patient. Okay, diabetic is also very much important. So half diagnosis will be made by the history. So history also provides the most important thing, and that helps a lot in the diagnosis to make good diagnosis. So diabetic patient having abdominal pain, nausea, and the alcohol use. And after lipid profile report, what we will see in it, that is total cholesterol is 240. Otherwise, it should be less than 200. It's high. LDL 120, while it should be less than 100. HDL 35, it should be greater than 40. And TG is 650. That is an alarming situation. because TG should be less than 150. So it's mean our main concern will be on the TG. It's too high. And when you listen the word TG, the first thing that comes in your mind is the pancreatitis, because increase in the TG level, so it will mainly affects the pancreas. So it causes the acute pancreatitis. So those patients having high TG, uh, having high risk of the pancreatitis in them. So that will be the hypertriglyceridemia, high level of the triglycerides, and it increases the risk of the acute pancreatitis. So that's why patient is presenting with the abdominal pain, nausea. So that is another important thing. And diabetic patient and the alcohol use will also increase the level of the triglyceride. So that is another important thing in diabetic patient, and in patient uh, who use alcohol will also having triglyceride in them. So in the treatment, so immediate treatment will be, we have to admit the patient in the hospital, and we also have to give IV fluid, and we also manage the pain, because patient is presenting with the abdominal pain, and we have to stop the alcohol usage of the patient. And we will suggest low fat diet, and we also have to control the diabetes, because insulin, low level of the insulin increases the triglyceride level, and increase in the triglyceride level, that will exaggerate the uh, pancreatitis in them. And the drugs we will use fenofibrate and the fibrozil and omega 3 fatty acids. So these are the drugs that helps in the reduction in the triglyceride. So this is the second case. Third case is the 50-year-old obese smoker having obesity, smoking, and dyslipidemia. Dyslipidemia also present in the history of the patient. And after lipid profile report, what we will see: 180 total cholesterol, that's normal. LDL 110, that's not too much high, but it's high. And HDL, it's too much low, and low HDL means high risk of the cardiac diseases or MI, or coronary artery diseases. And TG is 170. So low HDL dyslipidemia. So in that case, we have to change the lifestyle of the patient. So that is the most important management in case of the low HDL dyslipidemia. So patient has to stop the smoking, okay, because smoking decrease the HDL level, and patient has to reduce his waist, and uh, have to do some aerobic exercise, also have to add some proper diet. So this is the management in case of the low HDL dyslipidemia. And the fourth one is the 40-year-old woman, fatigue, weight gain, and cold intolerance. So these things, weight gain and cold intolerance, most probably seen in the hypothyroidism. So in the lipid profile report, what we will see in that case: total cholesterol 300, it's high, and LDL is 210, that is also high. HDL 50, that's also high. And triglyceride is 180. So all the things, cholesterol, LDL will be high, so it can go towards the heart diseases like MI. And in that case, you in the thyroid profile, TSH is high. When the T3 and the T4 is low, then the TSH will be high. So it means that it is hypothyroidism, low level of T3, T4, and ultimately that will, by using feedback mechanism, it will enhance the level of the TSH. So that is the secondary dyslipidemia, because cholesterol level is high, not the primary, because in primary there will be the no concern of another disease, but in that case there is a concern, that is hypothyroidism, that causes the high level of the cholesterol and the LDL. So in the management, we have to uh, we in that case we just have to manage the cause. In that case the cause is hypothyroidism. So we have to treat the hypothyroidism, and after its treatment, ultimately the lipid profile start improving in that case. So in that case, we have to get the levothyroxine. Levothyroxine will treat the hypothyroidism, and ultimately the lipid profile start improving. But in that case we also have to give the statin along with that, because currently the cholesterol is high. We also have to reduce the cholesterol by giving the statin. So this is the scenario in case of hypothyroidism, low level of the T3 T4 that causes the high level of the cholesterol. So that is the fourth case of the lipid profile. So this is all about the four clinical scenario of the lipid profile. If you still have any question, you may ask in the comment section. Thank you so much.